All right, we got some more hip mobility for you. And again, I love active control drills. This one's going to be called a hip CAR. Again, CAR stands for controlled articular rotation. This should be completely pain-free. If it's not pain-free, you need to shorten up your range to the point that it is pain-free. Now, with this controlled articular rotation, you want to move your hip through an entire range of motion. So if I think about ball and socket, what I would want to do is I want to, my hip joint should be moving completely in that socket. That's exactly what I'm going to be attempting to do with my leg here, okay? So this is going to work for a couple different things. It's going to help, loosen up some muscles if you got some tightness around that. It can potentially help loosen up the joint capsule or the joint as a whole, which can sometimes get bound up as well. When you go to squat or you go to run or you go to jump, any of those kind of things, if you've got some tightness at the hip, it's going to manifest itself either in the low back, the knee, somewhere else, or even isolated at the hip as well. And again, so many times athletes' first line of response for an injury is to completely shut off all activity. And in fact, you really need to be moving in some capacity. That's why I love CARs. It's one of my go-tos in the early phases of an injury with an athlete. So what we want to do is you want to get a bench, use your ottoman, something like that. And again, I'm just going to scribe my hip through an entire range of motion. Now the key with this as well is you want to try to stay pretty neutral through the low back. Obviously you're going to move a little bit through there, but you want to stay neutral through there as much as you can. So again, I'm going to start backwards. I'm opening my hip up all the way, and then I'm also coming all the way up into hip flexion as well, okay? Now if you've got pain all the way in this position, what you're going to do is, or all the way back, you're going to shorten that range up. As you start going, it should loosen that up where you can start going into a new range of motion. So again, I'm scribing an entire range of motion here. Okay, we're going to go 10 to 20 one direction, and then we're going to hit it the other direction as well. So come all the way into hip flexion, all the way into external rotation, all the way back to the extension, obviously minding not getting into that hyperextended position at the low back. And then I come around again. So give that one a shot, scribe circles of that hip. Again, keep it pain-free, and I guarantee it'll feel better afterwards.